like that. You like it like that. like that.
and for the International Generic and Biosimilar Medicines Association. I warmly welcome you all, our distinguished panelists, and our participants from many organizations which are directly or indirectly involved in the negotiation of the pandemic accord. This accord is a generational opportunity that we must seize, and you must be the generation that makes the changes that help future generations to be safer, said Dr. Tedros in a video communication. The global generic and biosimilar medicines industry have been at the forefront during the pandemic by providing the much needed medicines, and in particular in the intensive care units. It is therefore our responsibility to be actively involved in this debate. Now is the time to reevaluate the global pharmaceutical supply chain, address its vulnerabilities, and be better prepared to deliver safe, life-saving and equitable healthcare in the most efficient manner, while at the same time preserving a global diversified supply chain. We start the webinar with a presentation on the accord as it stands today and its impact by Archana Yadgar, who is our chair of the International Trade and IP Committee, followed by a panel discussion, which is moderated by José Luis Cardenas, which is the vice chair of the same committee. Now, our distinguished panelists are David Frankas. Maybe you raise your hand so that everybody can see. David Frankas, who is professor of data and supply chain analytics at the Worms University in Germany. We have Americo Beviglia Zampetti, who is Minister Counselor for Health Matters at the Permanent Delegation of the European Union to the United Nations Office and the World Trade Organization in Geneva. We have Summer Galloway, Director at the Office of Pandemics and Emerging Threats, which is part of the Office of Global Affairs at the United States Department of Health and Human Services in Washington, D.C. We have Adrian van den Hoven, who is Director General of Medicines for Europe and the incoming chair of the IGBA. And last but not least, we have Emily Bleimund, Director at the Office of Trade and Health at the United States Department of Health and Human Services in Washington, D.C. We will leave some time for the exchange with the audience. So some questions have been raised already by some participants in advance, and we have shared them with the panelists, but there will be a possibility to add additional questions and put them please in the chat box, and also to whom you would like to address this question. I wish us all a very fruitful and interactive webinar, and thank you already from my side for your participation. Archana, the floor is yours.
Thank you, Suzette. Hello, everyone, and thank you so much for participating in this very interesting webinar. I'm delighted to present you an overview of the pandemic accord, which is being negotiated by the WHO member countries. This is based on the latest available draft in the public domain. Can we go to the next slide, please? For decades, the world has been unprepared to stop infectious disease, and early on in COVID-19, we saw countries struggling, unprepared, and the opportunity to mitigate impact was either missed or was not timely. There were major issues, major inequities in access to tests, vaccines, drugs, and other measures. Early in COVID-19 pandemic, there was a widespread disruption of global trade, creating challenges for the uninterrupted supply of essential medicines, highlighting the importance of uniform support for resilient supply chains. As the impact on global supply chain continues with the current geopolitical situations, the need for a robust and adaptable supply chain that can withstand shocks and emergencies is well needed. All this and many factors gave an historic opportunity to create a new global architecture for pandemic preparedness and response to ensure that there is no outbreak, whether a pandemic, a natural disaster, or a war. The World Health Organization's member states thus established a process to draft an accord on pandemic prevention, preparedness, and response. Next slide, please. In this slide, I have tried to show the timelines in how the pandemic accord has progressed. The purpose of the pandemic accord is essentially to stop outbreaks becoming epidemics or pandemics, and if they do become a pandemic, how to manage them. In December 2021, WHO's 194 member states agreed to negotiate a new agreement, a convention on pandemic preparedness and response. An intergovernmental negotiating body, that is the INB, was established with a 2-year mandate to deliver an accord for consideration by the World Health Assembly in 2024. Member states meet virtually and in person on a regular basis as a part of INB. INB in the early last year started a phase-wise work with an aim of agreeing on the way in which that this would work and defining how best to engage various stakeholders in an inclusive manner. Member states started the second phase of their work as a part of INB in July last year by initiating discussions on elements that could become part of the future accord. The INB took several important steps by discussing a conceptual zero draft of the accord in December 2022 and agreed that the INB Bureau should move forward with producing a zero draft of the accord. It was also agreed earlier this year that the zero draft would become the basis for negotiations of member states on a pandemic accord. Moving further, it was decided that in February to April meetings, which formed an integrated set of meetings focusing on reviewing the zero draft. And the INB, as a result, reviewed in detail the zero draft and provided additional textual proposals. The INB further agreed that the Bureau would compile the textual proposals received and provide Bureau's text showing options where feasible for consideration of member states. The World Health Assembly has mandated the INB to submit its final outcome to the 77th World Health Assembly, which will be held next year in May. Next slide, please. This slide is basically provides outline of the objectives and the scope. A pandemic accord could create the objective of this accord is to create a stronger national, regional, and global systems to help contain future outbreaks and also ensure an equitable, coordinated response. Countries have agreed to pursue a legally binding pandemic accord, potentially giving the accord the authority needed to hold countries accountable to prepare and respond to future health threats. The new accord represents basically a global commitment to work together to prevent future pandemic. Next slide, please. In this slide, what I've tried to do is to show how the accord looks like. It's basically divided into 3 chapters and each touching upon a major topic. The chapter 1 includes objectives, scope, and principles. Chapter 2 covers areas which are critical in achieving equity in and for the preparedness. It contains several areas such as the sustainable production, tech transfer and know-how, global supply chain and logistics, regulatory strengthening, compensation and liability management, so on and so forth. And the third very important segment of this accord is institutional arrangements and final provisions. Moving on to the next slide, please. In today's webinar, what we're trying to do is to focus on two elements, sustainable production and supply chain. If we look at the current draft pandemic accord, three elements are of vital consideration. One being the equitable geographical distribution, which covers how can more equitable distribution of production can happen, how to identify and maintain production facilities, what kind of international coordination on public health, intellectual property and trade is required to match the demand and supply. Should should we have a system of granting non-exclusive royalty-free licenses to manufacturers, particularly in developing world? And what kind of know-how transfer initiative should be taken? The second key element is to initiate or strengthen as appropriate the conduct of disease burden studies relevant to the pathogens with pandemic potential. The idea is to ensure the sustainability of investments in facilities for the production of vaccines and therapeutics that could support pandemic response. The third critical element is on access to friendly R&D practices, wherein member countries are discussing on encouraging R&D and how manufacturers can waive off their royalties on the use of their technology for pandemic-related goods. Can we promote voluntary licensing, transfer of technology by private rights holders with established regional or global technology transfer hubs or other multilateral mechanisms? Next slide, please. The pandemic accord then goes on to also talk about global supply chain. It establishes a global supply chain and logistics network. This network will operate within the framework of WHO in partnership and collaboration with relevant organizations internationally or as may be required, and are essentially be guided by equity and public health needs, particularly paying attention to the needs of developing countries. Important issues that are being negotiated in this global supply chain is on how can we predict supply forecast, demand planning, food procurement mechanisms, guide on how to keep stockpiles, relevant logistic capabilities, transparency to promote cost, price and contractual term visibility, and so on. Moving on to the next slide, please. Another important, can we move on to the next slide, please? Another important subject is, of course, the supply chain, which is an essential part of this webinar. This is covered in the Article 13, which covers 5 essential elements. The text, if one looks at the text of the Article 13, it suggests that each country in its government-funded purchase agreements for pandemic-related products, as possible, exclude confidentiality provisions that serve to limit the disclosure of terms and conditions. That is, make it public, which is a very important provision. Second, being countries will recognize that any emergency trade measures in the event of a pandemic shall be targeted, proportionate, transparent, and temporary, and do not create unnecessary barriers to trade or unnecessary disruptions in supply chains. The third element being countries shall commit to ensure rapid and unimpeded access of humanitarian relief basis the international humanitarian law, and also to respect the principles of humanity, neutrality, impartiality, and independence for the provisions of humanitarian assistance. The last being, countries are also expected to enable inclusive equitable and effective cooperation and participation. And all this has to be done. I think you need to go to the next slide before Sunidhi. Countries are expected to take these measures no later than 31st of May 2025. Now moving on to the next slide. At IGBA, we believe for a resilient supply chain, there is a need for transparent global collaboration for patient access to medicines worldwide. The focus should be on measures such as better monitoring of supply chain vulnerabilities, especially for the essential medicines, creating incentives for supply resiliency, building emergency capacities, and also promoting international cooperation. Early on in its advocacy, we had in our zero draft emphasized that the focus on sustainable production and the procurement systems have a direct impact on the sustainability of production. Whether procurement is managed locally or globally or at regional level, procurement policies have direct market shaping impact and therefore can result in lack of viability for ongoing production, risking supply of relevant products. Our experience as a generic and biosimilar industry has shown that a procurement system focused only on pricing and not on other aspects such as the supply security or quality assured products is this encourages the concentration of supply, and this is driven by economies of scale and need for the lowest available raw material and manufacturing cost. The risk that it imposes on the medicine supply chain and the trade is directly counter to the intention with which the pandemic accord is being instituted. We sincerely urge the negotiators and the leaders to consider inclusion of a recognition that procurement considering criteria beyond price is an essential component of health system resiliency. This approach also finds a precedence as a best practice in procurement system management. For example, last year, the European Commission made a series of recommendations related to procurement of medicines. This included on applying the most economically advantageous tender criteria, which considers the criteria beyond price, and awarding contracts to multiple winners instead of pursuing a single winner approach. These kind of measures are aimed at creating a well-defined mix of criteria for procurement and avoids over-reliance on a single manufacturer, which can lead to shortages in the market. So far, the policy solutions that are proposed focuses on maintaining and expanding production facilities, production scale-up models, and coordination between international organizations, licensing, etc., without actually directly mentioning the need to develop the conditions for sustainable procurement models. Not addressing this matter will also affect the objectives pointed out in Article 13, which is related to the global supply chain and logistics network. The second important part which the IGBA supports is the identification of the need for greater harmonization of regulatory requirements and practices to facilitate entry of medicines into the markets around the world. Here, we also urge the negotiators to further strengthen the focus on regulatory efficiency in order to achieve timely, equitable access to health products, including through a recognition of importance in advancing single global development of generic and biosimilar medicines. There is a growing consensus among regulatory authorities that reliance among regulators is an important tool for consideration in advancing regulatory efficiency. In addition to harmonization, convergence and capability building of national regulatory authorities, and shifting to the newer tools, newer digital tools. Moving on to the next slide, and just a way forward that we at IGBA think are how we can deal with the how can we achieve the goal of sustainable and production and resilient supply chain is if we can establish 4 key areas basically. How can we establish collaborative platforms between amongst government, industry, and other international institutions and stakeholders? Adopting policies that support continuous flow of medicines and associated products across borders through enhanced international trade. Third element being, can we advance harmonization of regulatory requirements and single global development of generic and biomedicines, and establishing sustainable procurement systems for medicines, which includes criteria beyond price to enable resiliency in supply. Thank you. This was, thank you all for your patient hearing, and may I now hand over the floor to my colleague, Jose Luis, who will take forward this discussion on global supply chains and procurement, sustainable procurement topic in the next panel discussion. Over to you, Jose Luis.
Thank you, Archana. It's a pleasure to be here today and also moderating this panel discussion with
good luck for your daughter. Okay. Yes. Thanks
panelists.
a lot.
Sorry. So it's a pleasure again to be here today for this great and important discussion, a global discussion on the pandemic accord, and to provide more visibility on where we are with this, crucial negotiation with global impact. And again, it's an honor to have this very, distinguished panel of experts. And I wanted to start by asking Professor Francas about where we are in terms of the global supply chain of pharmaceutical products and pandemic-related products. And if, in your opinion, Professor Francas, the agreement is going in the right direction to support a more resilient supply chain moving forward?
Broad question, to be honest. I think what we see at the moment, certainly beyond this pandemic accord, is that resilient and also combating shortages has emerged as a key topic in the industry, as well as for all the organizations in public healthcare and medicine. I think that's something we have to keep in mind. And we also have to keep in mind the challenges we need to address when looking at resilience. So we have very complex global supply chains. So part of the production happens maybe in China, products are transferred to India, further produced in, let's say, Europe, and then finally packaged all over the globe. And that's just one example. So we need to have more transparency. And I think that's certainly something where we have a broad consensus, both in academia as well as in industry. So we need to have transparency first into the supply chains, into the vulnerabilities, in order to really improve risk management and improve crisis management. And if we remember the early days of 2020 in the pandemic, that was a key challenge for authorities as well as for the companies to really understand, okay, which part of the supply chain is really affected by the pandemic, what's going on. That being said, for sure, Article 13 raises some very important points with regard to strengthening the resilience of supply chain, strengthening transparency. For sure, we need to first understand what are the crucial items, what are the crucial products, the crucial medicines in a pandemic. We also need to improve transparency, understand, for example, as also mentioned in the Article 13, what are the supply sources, what are the capacity, what are the inventories. That's the foundation. Before we start improving the supply chains, adding more resilience, that's the first exercise to be looked at. And then, of course, the other measures, think about more efficient procurement mechanisms, thinking about more inventories or stockpiles, more capacities, are certainly all measures that can lead to more robust, more resilient supply chains.
Thank you very much, Professor Francas. So, question for Americo, and basically based on whether we already heard about where we are with the supply chain and the challenges we're facing. Can you please provide like an overview or your opinion on where we are with the current negotiation, and if the current status of the text is again moving in the right direction of having a more resilient supply chain moving forward?
Yes. Good afternoon, and first of all, let me thank you for the kind invitation and the interesting meeting today. Well, I think we are still pretty significantly in a sort of negotiation phase where things are not sort of getting, clarified to the level where we can take an informed view whether we will be having results on the ground or not. The language is still very convoluted, and we are not yet in a position to really judge whether the economic sort of objectives, the public health objectives would be served by this text. So I think we need to be perhaps still very much with a suspended judgment on where we are. There are elements which are useful, and that has been recalled, but the quality of the provision is still pretty much to be improved. No? So I would say that we really need to wait and see, and let the negotiation run for at least another couple of months to see where we are. There are provisions in the area of support for diversification and regionalization of production that you would think would be useful in terms of creating a more diversified supply chain. There are provisions in Article 13 that may turn out to be useful, but I guess at this particular point in time, we really cannot take a judgment whether this will be, a useful instrument or not. We are trying, and of course, we welcome input from stakeholders like yourself, and the meeting as this may be useful, but it's a little bit premature still to see whether we are going in the right direction or not. To come back to your question, thanks.
Thank you very much, Americo. And in your view, do you think all the relevant topics are already included as part of the pillars that are relevant for the for having a more resilient supply chain, or there's still some room for improvement, and to add other elements that would help the global supply chain of medicines?
I think there is room for improvement, sure. I think there is room for stakeholders to sort of inject their own views and priorities and in the process. It is not easy to capture in an international agreements elements that are more policy measures and not obligation that you can take at international level. So there are limits for the instrument to deliver on what may be necessary. That being said, I think there is room, and again, we would welcome inputs on these matters. Thanks.
Thank you very much, Americo. Very interesting answer. Question to Samber now. So as someone with extensive experience in scientific research and deep knowledge in the functioning of viruses, would you say that the actual form of the accord is setting up the foundations for the pharmaceutical supply chain that can adjust to the behavior of the viruses with pandemic potential?
Yeah, so thank you for the question, and also thank you for the invitation to participate. I think building off of a little bit of what Americo said, I think the foundations are there. I think that the core elements that we want to see addressed in the accord are there, but I think we still have a long way to go to make sure that whatever we are setting up as part of the accord is not only flexible, but can be easily adapted. It reflects a true partnership. I think the one thing that is certain about viruses is that they will evolve, and they will evolve rapidly, and they will evolve based on any medicines that you put to them. We see that with SARS-CoV-2. We constantly see this with influenza. And so I think whatever system that we're setting in place, when we're talking about supply chains or we're talking about access to medical countermeasures, that needs to have some built-in flexibility, some built-in agility, and it needs to let the processes that work really well, which are R&D, and quite frankly, manufacturing to some extent. I mean, I think there are places that we can really do better. Those things, they need to be able to operate the way that they do. We don't want to see something that puts in place sort of a single point of failure. And I think with some of the original proposals that were in the text, I think there is a risk of setting systems up or networks that do create a single point of failure. And so I think we need to really have a look at this. And I think at the end of the day, public-private partnerships are going to be absolutely essential to our success to be able to deliver on the ambitions of the accord, and to make sure that we can deliver medical countermeasures in a timely way and in an equitable way around the world. So I think that's one of the biggest issues that I see with the current text, and one of the ways that we're really trying to work with stakeholders such as yourselves and others to understand what those challenges are, what the limitations are, and how we can improve on the text, and make sure that whatever systems we're setting up are going to be flexible, fit for purpose, and are able to be effectively operationalized and implemented in the midst of a pandemic emergency. So I think we have to be very cognizant of that. It's not something, viruses, like I said, they change really rapidly. And so we have to be even faster and anticipating what those changes might be. So.
Thank you very much, Summer. It's very interesting point of view based on your scientific background. Also a question for Adrian, and basically to understand the role that the generic and biosimilar industry supply chain play during the pandemic, and if you see that we're moving in the right direction in terms of the negotiation, again, having in mind that we obviously need to improve in terms of resiliency of supply chain.
Thanks, Jose Luis, and thanks for inviting me here today. I think our industry during the COVID pandemic played a critical role. We were the first in the pharmaceutical industry to recognize the major disruption that COVID would have on our societies and on our industry. And this is because of the fact that before the vaccines were available for COVID-19, you essentially had treatments in hospital which required a huge, massive amount of generic medicines, generic hospital medicines. I'm very happy that we here in Europe, but also with our IGB colleagues, we almost immediately went into action to address those major challenges. And by major challenges, okay, the demand in Europe for ICU medicines, okay, went up by 2,000% in March 2020, 2,000, right? When we calculated it later, this was inflated by people trying to hoard, but the actual demand was 1,000%. Okay, so this is absolutely massive. When you're talking about these types of production, okay, sterile production. And I'm so happy that we coordinated here in Europe with our industry, but also with our international colleagues, because we were able to address this and respond. Now, I think we have gotten better as an industry because of the disruptions which have continued following COVID with the war, the Russian invasion of Ukraine, and other things, further disruption after disruption. The industry has much more resilient inventory policy today. And so we are much better prepared for the kind of yo-yo ride that we are in infectious diseases, for example, right now. So I think that's really positive. Now, where the pandemic treaty comes in for the future, I think this is such an important treaty, and that we need to be fully engaged as IGBA. Prior to COVID, the European Union was totally loosely organized. Okay, really didn't know what it was doing in the pandemic. But now after the pandemic, it has basically modeled itself on the US system, the US BARDA system, which is a system based on national security. Okay. India more or less has similar laws to the US. China, well, they apply a similar policy. I don't really know much about their laws. But you have the 4 major medicine producing regions all have what is basically a national security policy for public health crises. Now, any national security policy will prioritize their domestic population, their national, or in our case, European population, over foreign population. That's how national security works and thinks. And in some ways that is necessary. So for example, in Europe, we need this coordination at a European level, because otherwise each European country, each European member state fights with each other. And this is unhelpful. So we need this. But we also need a forum where the US, Europe, India, and China commit to cooperate with the countries that don't have big production of important medical countermeasures, because they need some of our supplies. And we need that counterbalance to all of these necessary but very inward-looking policies that we have for future pandemics in the major pharmaceutical producing regions. So I really hope that this pandemic treaty is not just a paper document, but a living commitment to global solidarity in a future public health crisis.
Thank you very much, Adrian. Very interesting angles on the role that industry has played, and also how we can better collaborate moving forward. And now a question for Emily. So apart from your work with the FDA in HHS, you have worked alongside with the Access to Medicine Foundation. So could you please help us to better understand the principles for the negotiation of procurement agreements? And also, how is the Accord addressing this point? And how, in your view, can this be translated into national legal scenarios to increase access to medicines?
Thank you, Jose Luis. And thanks to IGB for organizing this today. I think we really welcome these opportunities to get together and talk about this important negotiation. I think procurement is definitely a really important topic for us as governments to be looking at in this negotiation. Obviously, during COVID, I mean, the governments are the purchasers at the beginning when there's scarcity, and we need governments to come together and make some commitments and agree to some standards that we can all follow as part of our responsibility in that position. And so, something the United States has really been promoting as part of this agreement that several other people have already mentioned this morning is this concept of transparency. That when we negotiate in a pandemic emergency, right, in this specific situation, when we have a crisis and we have scarcity of product and we have entities like the WHO trying to advise a lot of countries on what to do and what should they buy and is it available. We need this information to be out there. We can't expect our public health decision makers to make good decisions without information. And so from our point of view, transparency is really critical. And it's something that, we're asking for a commitment on this in the accord. We believe that key terms of purchase agreements should be public. We don't believe there should be confidentiality clauses in these agreements. And we are encouraging all governments to consider making this commitment, especially for, smaller governments. We hear stories, people say, I had no choice. I was presented with this contract and I had to sign it and there was nothing I could do. I couldn't change it. I couldn't publish it. And so, we really want to create a new global consensus that during a pandemic emergency, that's not how we behave, that we behave transparently, that we share this information, and that because of that, we will make better public health decisions and we will increase access to medicines ultimately by doing this. So I think that's one key principle for procurement. Another thing we saw during COVID with the contract negotiations was delays caused by lack of negotiating experience, caused by the need to negotiate terms like liability protections. And a lot of countries weren't familiar with this. They didn't have experience with it. They didn't have national frameworks in place to provide this type of liability protection. They maybe didn't have access to no-fault compensation funds. Some of them had to pass laws in order to sign these contracts with these protections in them. And we fully understand that manufacturers, especially of novel products, right, need some kind of liability protection. In the US, we have a whole, statutory system in place for this. It's very expansive, but, of course, we understand that not all countries can do that. But we do think it's really important to prepare for this in advance. And that we do have an article in the agreement right now on liability risk management, and it's something that the U.S. has been really promoting. Is this idea that we'll agree to some standards, we'll ask WHO to put together some recommendations, but mostly that countries will have a strategy in place, and they'll make this strategy transparent. Again, more transparency, right? You will tell the world, here's how we're going to handle this issue when this comes up. And we've passed the laws and we have everything in place and we know the trigger that we're going to pull and we know what our contracts are going to say. And we're all ready for this scenario because we saw contracts being delayed by months because of these liability negotiations. And that stopped access. It stopped it just as much as the lack of a regulatory authorization stopped it, just as much as a lack of supply stopped it. So each of these things, each of these barriers that we saw in and of themselves can prevent access. So we're really looking to identify what are the things we saw during COVID that happened that didn't go well, and what can we do in this agreement to help facilitate a better outcome next time. So the liability issue is really key. And one other thing I would mention that it was important for the United States and for other countries like us is, we really wanted, when we got to the point where we could share products, we really wanted to do that. And we did ultimately share a lot of products, but we have to make sure that our procurement agreements facilitate that as well. We need to make sure that when we purchase product, we are not only purchasing it with the view of protecting our own populations, but also we need the contract to be built at the beginning to allow us to share product outside of our territories as well, so that when we're ready to do that, we can do that quickly and efficiently. And we need to negotiate that really in advance, ideally, right? We need to know what those critical clauses are going to say. And those are sort of basic principles. I think there's a lot of interesting ideas that are being floated around as part of this negotiation about, how else we can use procurement agreements to promote access to medicines, because again, governments have, some governments are in a position of leverage at the beginning when we are spending quite a lot of taxpayer money to procure these products for a crisis. And so, our good friends in the EU, I know, had published some ideas back in the spring about using procurement agreements to require manufacturers to set aside some amount of product for offering to low and middle income countries, and that was kind of a unique approach. Some people have talked about using contracts to incentivize voluntary licensing, and using it as more of a legal tool to nudge these behaviors from manufacturers. And in fact, these are all things all of the governments are sort of discussing and talking about now, and thinking about, what would be the impact of that. And so I think there's a lot of ways that we can think of procurement as a tool for access to medicines, not just for our own countries, but for the world, and to try to improve the outcomes compared to what we saw during COVID. Thank you.
Thank you, Emily. Very interesting perspective. I just wanted to ask the panelists if they have any other perspective on what Emily just said, and about the role, procurement models, procurement agreements, and how they are being designed can play a role in impacting in a positive way access to medicines. Maybe if there are any examples that you would like to mention, and so on. I see Adrian.
Yeah, I have a couple of thoughts to add to this. I think if you look at a lot of the, let's say, lower and middle income countries, they may not have, as Emily was pointed out, a lot of experience. And sometimes there are these efforts to pool procurement, let's say through different support mechanisms or agencies. Either it's kind of nonprofit charities that are doing this, or UN agencies, or what have you. Certainly for us, we had quite a bit of experience with this pooled model in Europe as well. And what's very interesting in this is there were two very different models used. One was used for the vaccine contracts, where essentially the Commission was a central negotiator with the member states giving advice and saying how much of the vaccines they wanted, more or less. I'm simplifying, of course, a little bit. And that was, despite the ups and downs and the fact that too many vaccines were purchased, which in some cases makes sense. It was like an insurance policy. It was very efficient. It was very quick. It was 2 months to negotiate those treaties, despite the liability issues and all the complexities around that. On the other hand, the Commission also did another kind of pooled procurement where there wasn't a central negotiator. Basically, you had to negotiate with all of the participants in the pooled procurement. So let's say between 15 and 27 countries or negotiators. Okay, those procurements were a disaster because it took them 6 months on average to be negotiated in a crisis, right, when we needed them very urgently. I can give you an example. We had one for ICU medicines, which initiated in June 2020 for the second wave of COVID, because we were collecting data and we told the Commission the second wave of COVID will happen middle of October in Europe for sure, we guarantee it. So they did this, they said, okay, we need to do a joint tender to build up a reserve because there's going to be a second wave of COVID, according to the industry. We negotiated the first step of the agreement like in January. Of course, the second wave of COVID did hit exactly in middle of October. So we were already a month and a half into this. And this was only the first part of the negotiation. We still had to do contract by country, volume by volume with each country, which took about a year and a half. Okay. And in the end, not a lot of medicines were purchased because, let's say, the most acute or severe wave of COVID, the most deadly, was over by then. And what was so sad about this wasn't the fact that our companies lost a lot of money, which they did, okay? But these same products, okay, could have been sent to South America, which went through several waves of COVID. And we couldn't send them because they were tied up in this totally ridiculous joint procurement, because once we had committed, you could not move those volumes. You had to keep them in Europe, even though people were dying in South America. I mean, we cannot repeat this kind of nonsense, right? Where it's not, where the stock is available, So we really have to learn the lessons. I think for a lot of those countries that are going to be doing this pooled procurement, they should really look at what worked well in the European Union and what was a total flop and a contraindication for public health.
Thank you, Adrian. Anybody else? Maybe David, from your academic perspective, any thoughts?
Yeah,
on procurement model?
I think I can only agree to this, to the point mentioned by, I think, all participants, that procurement plays a focal role in the pandemic, during the pandemic, but also in order to become more resilient towards any disruptions that can occur in a supply chain. I think beside the right mechanism, of course, to be very fast in case of a pandemic, I think it's also the whole way those auctions, those procurement systems are set up. So I think in the past, the predominant approach was basically to have a cost-focused procurement approach, typically combined with a winner-takes-it-all approach, which has the huge downside of leading to a less diversified supplier base. So we don't see any multi-sourcing. We have many single sourcing contracts. Let's say from a cost perspective, this might be beneficial. However, this comes at the expense of being resilient, because if you just have one supplier, and if the supplier gets down for some reason, there's basically no backup. In a multi-sourcing environment, there are much more opportunities to basically balance a disruption in the supply chain. And I think this is not only a short-term perspective, but also a long-range perspective, because what we see at the moment is that, also in academia, that single sourcing procurement systems will lead in the long run to a less diversified supplier base. And it's also reducing resilience in the long run. And I think what we see, that there is some difference in thinking now. We have now a new law in Germany that was issued, that was, let's say, placed in action in June of this year, basically encouraging more diversification in public procurement of medicines, of drugs, so having not one supplier, but have many suppliers, also to put additional criteria in place, not to say not only price is the deciding factors, but also any quality related measures. So what is the resilience? Because we have to keep in mind, resilience comes at cost. Any measure, more capacities, more inventories, more diversification will come at cost. It's not for free. That's something we have to really acknowledge. That being said, we need to see if procurement mechanisms only based on price, it's very difficult to provide the right incentives. So we need a certain balance here in order to have more rewards for being resilient, and also to encourage a more diversified supplier base.
Thank you very much, David. Very interesting perspective as well on the role procurement is playing and should play in the long term. So, Americo, also you raise your hand.
Yes, thank you. No, just to note that on this matter, since you are placing a lot of emphasis on procurement, and rightly so, I would note that currently the text of the agreement in Article 13 has just a very, very small sentence, a very terse, but quite, I would say, useless statement, which says identifying the most efficient multilateral regional purchasing mechanism, including pool mechanism. I mean, that basically, a provision like that would not make a great deal of difference. So I think it would be incumbent on all of us, including stakeholders, to try to attach some concrete content to this kind of generic call for, being smart. And again, as I said, an international law instrument has limitation. This is something that would be there for quite a number of years. That, of course, is difficult to modify because you would have to amend the text with procedure which are long and sometimes complicated. But all being said, I think a reference of this kind is not going to move the needle much. So again, just an open appeal to you all to try to give it a little bit more of a substance, because it's not going to make a great deal difference otherwise. Thanks.
Yeah, we completely agree with this perspective, Americo. It's I think there's still a need to better define, how we can, maybe to include some certain principles that can be then implemented in a certain way or taking into consideration the different, angles of the national systems, but having a set of principles in terms of, high-level principles for procurement might be helpful as well. So, and now moving to the specific provisions. So, Americo just anticipated something around the Article 13, but let me start with Article 10. So it's on sustainable production. Again, it's nice to have a specific provision on sustainable production, but and basically the aim of this article is to increase the timely, fair, and equitable access to medicines. So it's something that obviously is it's a big need from a global perspective. But then it focuses on some policy options and like identifying, maintaining production facilities at national and regional levels. Also measures to scale up productions to kind of react to the new conditions of the demand under pandemic and under a pandemic scenario, and also the relevance of collaboration, licenses, models, know-how transfer. So it looks like an approach that goes in the right direction, but it's an open question to the panel. Do you think that all the elements that are relevant for this discussion or for achieving this goal are in there, or should we consider other elements as well? We just mentioned, we focus on procurement, and just wanted to hear the perspective of the panel. I don't know who wants to start. Maybe Emily, Summer, or Americo again, or anybody else that would like to take this question on Article 10.
Jose Luis, I'm happy to come in, although I'm getting an unstable internet message. So just give me the sign if I need to stop talking, or if you can't hear me. So yeah, just to say, I think, we believe Article 10 is very important. It's a nice, it parallels nicely with Article 11. These two articles together really address the issue of increasing sustainable manufacturing and diversified manufacturing, including through, things like licensing and tech transfer. So those things kind of all, go together in a package, I think. And, yes, one of the main principles is, we need more manufacturing during times of scarcity. And how can we accomplish that? We need manufacturers to move quickly. We need them to find partners. We need them to sign up for these licenses that we saw during COVID that did ultimately happen to a certain extent, but we need all these things to happen faster and more efficiently. And so, what can governments commit to in this agreement that will help facilitate that? And I think, one thing that we have to remind ourselves of, and sometimes remind, our stakeholders of, is that this agreement is an agreement of member states of the WHO who are governments. And so we cannot commit industry to do something in this agreement. They are not a party to this agreement. But industry is a very critical partner. And so, obviously most of these things we can't achieve without the private sector. And so, we need to figure out how to commit ourselves as governments to take steps that will ultimately, result in different behaviors and actions from the private sector in partnership with us. And so crafting those provisions in a way that makes sense from that perspective is important, and recognizing that sometimes we're going to need to make high-level commitments to increase manufacturing, to facilitate licensing. But the way that those are ultimately implemented, may take a different shape depending on the country, right? Some countries might have different legal frameworks in place that allow them to provide certain incentives that other countries don't. And so we need to allow for some flexibility there for how these provisions are implemented. But what we need to capture is the high level commitment and the spirit that, yes, we are going to do these things. We are going to accomplish these goals, and how we accomplish those goals. A lot of that will be part of that implementation process that we would hopefully, get a lot of feedback from stakeholders and other important actors in developing those implementation plans. But I think, in terms of the licensing and the intellectual property issues in the Accord, those are obviously very challenging issues. They are things that, that we see a lot of, divergent views on, and something that's going to be very challenging to solve. But I think from our perspective, one of our principles for this negotiation is that we can't break things that worked well during COVID. And one of the extreme successes of COVID was the pace of innovation and the success of the innovation that we saw. And we know that a lot of that is due to the frameworks and incentives we have in place right now through things like intellectual property rights and also public funding. And so, we don't want to disrupt those systems that we saw work very well during COVID in terms of producing life-saving products. So the question is, how do we maintain the systems that worked, but solve for the problems that we saw? And one of those things we want to focus on is how to increase that manufacturing volume, how to encourage and incentivize manufacturers to move more quickly, to find those partners. Obviously assuring all along that we have high quality products, that we have, regulatory authorizations in place. And that's another thing that we're promoting very heavily in this agreement, is this idea of regulatory strengthening, so that we have countries prepared to act in emergencies, so that they know, okay, here's what I'm going to do differently. In the United States, our Food and Drug Administration has a different system that they apply during an emergency, and there are different rules and different standards, even though the ultimate result is still based on safety and efficacy and all of those great rules that we apply all the time. There are some, changes to the timelines and some changes to the prioritization of the review. So we want to see countries thinking about this in advance. Again, this goes to the legal preparedness question. What are we going to do during a crisis? How are the rules going to be? And how can we work together better? And how can we be transparent about what we're doing? And all these things together will facilitate that increase in manufacturing that we need, and that increase in access. So it's a systems approach to look at all the parts of the system and making sure they're strong and that they're prepared, and that hopefully when we get that contract manufacturing and the licensing and the increase in production, that then the system is ready to absorb it, and the system is ready to move it through and get it to the patients who need it ultimately. And so that's our goal, is looking at this from a big picture perspective, with that increase in production in mind as a very important first step. Thank you.
High-level commitments and as international agreements, but obviously what we would like to have in the future, once the agreement is in place, is to have clear kind of KPIs to better understand if systems are moving the right direction or not. I mean, to measure progress, I think it's crucial as well. Understanding that having an international agreement only can focus on this high-level commitment, and it's up to the governments to implement these commitments in a certain way. I don't know if anybody else wants to provide some comments on Article 10, sustainable production, and the elements that are already in there, or some elements that you would like to have it as part of the discussion as well. Adrian.
He said, I think there are two things that Emily said that are quite important. I think when it comes to the IP and licensing point, I think this will obviously be a very sensitive and difficult part of the accord. And it would be a shame if the whole thing floundered because of disagreements on that. I think part of the problem is that for the EU and the US, it's much easier to negotiate if they have a very clear legal basis for such a thing in their domestic legislation. The US does to a certain extent, but the EU is only in the process of introducing a kind of EU-wide compulsory licensing system, et cetera, due to certain problems it had during COVID domestically, I mean, internally in the EU. That's a process that will take a little bit of time, but I believe if the EU and the US are able to look at their own legislation and kind of link the treaty to what is technically and legally possible in the EU, then, and the US, excuse me, then this could be a basis for some kind of compromise to find a solution. And this would make a lot of practical sense. I think from the other perspective with supply chains, I think we need to be careful. And I like what Emily said about, in the end, the governments need to partner with manufacturers and drug developers, and they can't replace them. And one of the very things I urge caution around is you can't turn a cat into a dog. So what I mean by that is the government might say to a drug manufacturer or developer, please work with this contract manufacturer and have them also produce your vaccine or your medicine or whatever. And if that supplier is unable to do that, if they don't have the qualification, the competence to do that, they will definitely screw it up. And that happened during COVID, for example, with the production of certain vaccines in the US, where one of the contract manufacturers designated by the government mixed a batch of two separate vaccines into one batch, which is about as incompetent as you can get. And that's the US, right, which is probably better at this kind of game than any other government in the world. At the same time, in Europe, our industry, because we have a lot of biologic manufacturing because of biosimilars, our industry volunteered to help some of the small vaccine developers who ultimately weren't successful. But these vaccine developers didn't understand anything about it. So our members were trying to explain to them how manufacturing worked and things like this, including your company, by the way, Jose Luis. And they just could not do it. They didn't have these very, very tiny developers, didn't have any capability to do that. So it was very, very difficult. And we were volunteering to do this kind of thing. So we need to realize that there's a certain technical capability that has to be there for this to actually work. So tech transfer is not just something on paper, it's a real process. And imagine in a pandemic, this is all going to be done virtually, right? It's not going to be people flying from Europe or the US or India to some place in the middle of nowhere and doing this tech transfer. They're going to be doing it online, which is extremely difficult. And that explains a lot of the problems with the vaccine production in Europe, actually. So I think we need to factor in a bit of hardcore reality into this as well to make this work in practice.
Yeah, Americo, you want
Yes.
to provide all the perspective on this?
Yes, on this issue of sustainable production, the I think the text as it stands, it's not particularly useful. There is a shared understanding that this is a very important thing, and then everybody should work in that direction. But then when it moves from those sort of general understanding and general principle to actual initiative actions that can be taken, the text becomes very unclear at the moment. There is not a sense of what could be usefully done to promote such diversification of production. There is the text sort of speaks to the notion of sort of a centralized type of identification of facilities that could be used to increase, step up production in perhaps in area of the world where production is limited. It is unclear whether this would be done in a way that would foster viable enterprise in these parts of the world, or would be more like a sort of set of subsidies that would be given to existing or newly established venture, and in order to have sort of an ever warm production facility that could be then put to use at a certain moment in time. So it's a very blurred type of approach, which as it stands now, I think would make very limited sense, and would lead to very limited useful action on the ground. So at the moment, there is a very solid, I would say, agreement on the overall objectives, but there are very confused idea on how to, achieve that objective. Thanks.
Thank you very much. Can you hear me well?
You're coming in and out a little bit, Jose Luis, in your video as well. Maybe while we're waiting for him, I had just another comment on the regulatory issue, which I think is also important, is the WHO pre-qualification and emergency use listing programs, and the need to strengthen those and make sure they're really functional and efficient. I think during COVID we saw some ups and downs with that, but we also saw how important it is to governments, to many governments around the world. They, regardless of whether FDA or EMA or anyone else has authorized a product, many countries still really, really want WHO to weigh in. It's very important to them and sometimes a requirement. And so, with the COVAX facility, we saw, there were a number of countries in the middle of the crisis who said, okay, fine, we'll rely on a different regulatory authority if it needed. But many of them still said, no, we need the WHO sign off. So given the reality of that, right, we need to respect that a lot of countries feel it's very important for WHO to tell them that it's okay to use this product. And if that's the case, then we really need to make sure that that system is strong. We need to make sure that the manufacturers are going to WHO quickly with all the information that's required. I think we saw some variation during COVID in certain companies that had a lot of experience working with WHO and felt very comfortable doing that. And so they had the staff and the resources to go to WHO quickly. They recognized that was really important. And then we had other manufacturers who were smaller and maybe not as experienced and didn't understand why that was so important. Maybe weren't as comfortable with the process. And so they might have moved a little more slowly. And of course, we don't have time during a pandemic. And so that's another thing I just wanted to note is that we really need to recognize some of those WHO processes as being critical, and we need to treat them accordingly. And we need to, wherever we can, including in this agreement, commit as governments to taking steps to strengthen those processes and make sure WHO has the support that it needs to do that job, given how critical we see that it was. Thanks.
Thank you, E. I think there is some problem with the internet issue with Jose Luis connection. So maybe I can put a question here, and if I can bring in David and first on what do you think about WHO's supply chain network that's been established, and do you see the demand forecasting or the supply forecasting and demand forecasting or design of stockpiling requirements how do you think it's a feasible option, or what would be your recommendation to actually look at from a resilient supply chain perspective?
I think that's a good question, and I guess in order to answer it, I think we need to maybe wrap up some of the previous points in order to avoid to mention them before. I think I would agree to the goals stated in Article 13. They make sense, and I think there's a consensus that both from industrial academic point of view that those are the right things to look at. But I would also agree to America's point that we are very vague. So it says we are implementing a network. In the previous version, there were still other options like partnerships mentioned. Right now, it's very difficult to make any real assessment because it just mentions a network. What is a network? So what are the resources, the capabilities of this network? It's very vague. I think the other point, which is very important, is the one mentioned by Adrian. So government shouldn't probably not try to control and to manage the supply chain. So certainly a centralized approach can make sense in order to balance national interest, to have a broader perspective. However, of course, we have to be sure not to try to overtake the execution of supply chains, because that's certainly the business where the companies are much better at. And I think that is a no-go, certainly. And then, of course, looking at the different goals for this network, this is a very ambitious one. We want to have centralized data transparency. Not so sure what kind of analytics, mechanics we are using here. We want to set stockpiles, for example. We want to define the right capacities. I see at the moment in Germany, just one country, not a big one, honestly. There are a lot of efforts and discussions just to introduce an early warning system for one single country and to decide on what are actually the right goods for stockpiles, what are the right approaches for setting stockpile targets, and so on. Doing this at a global level is, of course, even more complex, and I have a little concern that this might become too ambitious, that we basically try something that is too much. But overall, this is basically a choice between centralization and decentralization. A centralized approach can balance different objectives, can balance different interests, which makes sense, can provide more efficiency, consistency, can ensure efficient allocation approaches. However, it can become too complex, too bureaucratic, and it needs really the right capabilities. And unless no one really says what are the capabilities, the resources for this network, it's very difficult for me, at least, to make a valid assessment of its, whether it will function or not.
Thank you, David. Does anyone has any comment to make on the logistics supply network? Adrian, yes, Adrian.
Yeah, thanks, Archana. Well, I think there is some sense to this. I mean, in practice, Suzette, together with you, Archana, and a few of us, we actually had a generic industry dialogue with the WHO about crisis-related products, and I think it was a very good process. It was very loose, let's say. There was no legal obligation for us or anybody to do this, but I think we really tried to find out where the shortages were, which one of the generic industries could help, and this kind of thing. So it was quite positive, I would say. Kind of looking forward, I recognize the challenges of this kind of doing this at a global level in a very formal, structured way. It's going to be difficult. That said, I think there is one area of extreme weakness in every jurisdiction, which is that the US, Europe, Africa, China, everybody, they have centers for disease control, okay, who do epidemiology, who monitor what is going on. And that is, of course, very important in a public health crisis. It's vital. But none of these agencies can provide any useful information to manufacturers, okay, because we have an issue with lead times. Okay, it takes us a couple of months to adjust the manufacturing to the demand. And also we need to make a distinction between what are basically hoarding strategies by governments or wholesalers or hospitals or whoever, and the real patient need, because it would really be sad if we produced an extra volume of, let's say, medicines or vaccines that were needed, and then we just give it to somebody's stockpile, and in some other country there are patients dying because they don't get it. So we really need to have a discussion with these centers for disease control to take some risk of making epidemiological projections much further in advance, like a few months in advance. This would be helpful information for manufacturers, because then we could say, okay, China's foreseeing this kind of epidemiological development. China is a very huge place, needs a lot of medicine or vaccines or whatever. Africa is very huge, needs this much. Europe's very huge, US very huge, whatever, all those huge areas. And then we can think about that and we can say, okay, there are probably going to be a lot of pressure coming from that demand. And also because, during COVID, right, we went into COVID spirals at different times. China, then Europe, the US very shortly after Europe, and then India much later. We can play on those cycles to supply in a more efficient way when it's needed, right? But we need to have a kind of indication of when it's coming, and that's something we should really discuss, but that requires the Centers for Disease Control to take much more risk than they're willing to take today.
Right, thanks, Adrian. Jose Luis, are you in?
Yeah, can you hear me well?
Yes.
Okay, sorry again for the technical difficulties. So it's part of life. So thank you again for the reflections so far, and we got some questions also from the audience also in advance, and the first one would be, how have this societal expectation and access to medicines changed as a result of the pandemic? We see a different level of awareness in terms of the relevance of access to medicines, So before the pandemic, we thought that we were in a much better place, but now we understand that we need to improve the system. But do you think that this is still something of helpful in terms of pushing the agenda, the dialogue on the relevance of having a more robust system in place that would help access to medicines?
I can come in, Jose Luis. I guess just going back to some of my comments before. I mean, I think there's so many things we can capitalize on as, I guess, a silver lining of having gone through COVID, things that we realized didn't go well, but that would have and improvements we can make, but that would have real benefits, not just for emergency situations, but also for access more broadly. For example, regulatory strengthening. We've been talking about this for many years, and having a pandemic and having this moment of scarcity and crisis and loss of lives and panic just highlights an issue like that so much and makes people realize how important it is. But it's important all the time. It's not just important during an emergency. It's just that it's much more apparent during an emergency. But we can use this as a lever to really motivate governments to make these changes that they need to their systems. And I think even if the changes they make and the laws that they pass are just triggered by a pandemic emergency, a lot of the changes they make will have, I think, more systemic benefits for them across the board. And of course, they can choose later, right, if they want to use some of those processes for non-emergency situations. That's up to them. But as a general matter, we're talking about strengthening systems, and same with the PQ process, right? I mean, we use that process all the time. That's not just for emergencies. So let's work on strengthening that in the name of pandemic preparedness, but also with the benefit of access to medicines more broadly. So I do think that the pandemic has really, shown a light on some of these longer standing issues. And I think it's a great opportunity for us to take advantage of the attention that we have and the motivation that we have, while people still have these experiences in their recent memory, to do something about it. And so I think that's one reason why we're really hopeful that, we can get some good outcomes here of this negotiation, but that also hopefully, all those implementation conversations and things that will happen after an agreement is adopted, right? There's so many things that will happen next and so many conversations that will occur, and we can use that as a springboard for all kinds of good, positive changes that I think will impact access more broadly in the future. Thanks.
And if I could just
thank you, Amy. Yeah, please.
I was just going to come in and I think maybe to echo some of the comments that Emily made. I mean, we've been the point was made that we've been talking about this for years. I mean, especially when you think about influenza and pandemic influenza. In 2006, we had the Global Action Plan for Influenza, which the aim there was to increase the global availability and equitable access to influenza vaccines. And I think that was a great program, but I think we have a lot of lessons to learn from that. And I think this kind of also goes back to this vicious cycle of panic and neglect that happens when it comes to funding and sustainability for public health. That one of the lessons learned from the influenza gap program was, we invested a lot of money to have these warm bases of manufacturing, and in the end, they weren't there. It didn't bear fruit in the end. And so I think we really have to underscore, I think the implementation component of this pandemic accord is in some ways more important than the words that we put on the page in the accord, because that takes our sustained commitment. We need to capitalize on the urgency that we have now and on the momentum that we have to do better, but it really takes sustained commitment to continue to improve these processes. We're never going to have a perfect system, but I think we will always need to improve the system. I don't think it's ever going to be where it needs to be. I think that's just something that we should just accept and know from experience. But I think we really have to underscore the amount of resource mobilization that is going to take on all governments. You can't donate your way. You can't, provide. You can't donate your way out of these challenges. Like, it takes a lot of domestic resource mobilization to see these things through and to sustain the kind of manufacturing capacity that we're talking about, the kind of supply chains, like all of these things. It takes a lot of domestic resources to make sure that these things are sustainable. And so I think that's one of the biggest risks that we face, just based on our previous experience dealing with this, is not having that sustained commitment and sustained resources devoted to ensuring that these things are going to be there for the next pandemic emergency.
Thank you very much, Summer. Anybody else who wants to comment at this point? Or
I'd like to maybe ask a question, Jose Luis, to Emily and to Summer as well. I mean, I agree. I think it's a great initiative. One of the key objectives of IGBA is actually to align towards something called single global development, which would enable the development of, say, a complex form of a generic or what we call a value-added or a hybrid medicine in key regulated jurisdictions around the world, including the WHO PQ process, I should add. And this could be highly relevant, say, for antimicrobial resistance development, right, where we need to look not only at completely new molecules, but what we need to do with existing molecules or pediatric forms or various things like this. But, the reality is that we cannot get the European Union and the United States to agree to do this. Essentially, the US and Europe are the barrier to this, because the FDA and the EMA and the European regulatory work is a little bit more complicated, as you know, in Europe, refuse to align. Do you think we could maybe use this to advance that issue? Because from a scientific point of view, there is no doubt that this is possible. It's really a legal hindrance, I would say, between the FDA and the EMA and the European regulatory network that makes this impossible. And it's super relevant, like I said, for pediatric forms of these anti-infectives, which is I would call it a kind of perma-crisis for dealing in the future with AMR. But we're just not able to do it, and we're not able to advance it.
Thank you very much. Any other comment on this point as well? Okay, so thank you again. I think we have had somebody raise a hand. No? Americo.
Yeah, no, just a very quick observation. I am in terms of the regulatory provision of the agreement. I think that is an area where some good work could derive, and so we are pinning a lot of hope on that particular article that can really catalyze some good action that can facilitate better prevention, preparedness, and response. So that is indeed an area that we see as quite positive. Thanks.
Thank you very much again. So kind of summarizing what we have discussed today. So there's I think a big agreement on the need to tackle the shortages that we are facing, and it's not only about the pandemics, but it's also what we are facing in normal times. So it's something that we need to fix, and also David, pointed out about the complexities of the supply chain, globally speaking, and the need first to have a more transparent system that would help to manage in a better way the risks that are involved in global supply chain moving forward. So, and But there's also a big agreement that in terms of the need to have a flexible text that would adapt to the different situations and also to the different legal system, to the different countries that can be implemented in the right way, that can be adjusted to the different situations that we might face in the future. Also, it was pointed out that there's the key role that the private sector is playing in the public-private partnerships, which are crucial for having a more robust system that can react in an appropriate way, not only during pandemics but also normal times. That is also fast enough to adapt to the viruses and evolving viruses. So that's a big challenge as well. And how to have also national policies or national security policies that should adapt and put in place during pandemic times as well. Another important point, and I think that's also part of the discussion right now, it has to do with coordination of different stakeholders, private, public, social society as well, as a way to have a more robust system. So again, there's a consensus of having a more transparent system, more information as a starting point, for fixing the system, moving forward. And we see that both the Article 13, but also in connection with Article 10 in connection with Article 11 is moving the right direction as well. Article 13 same, but there's still room to improve what's in the current text. We said, and we also pointed out and focused on the relevance of procurement models and how procurement models and systems are impacting the concentration of the supply side, and the need to have a multi-source system that can better react, again, not only during pandemics, but also in normal times. So I think there are many aspects that were raised that can be an input for expanding this negotiation of the pandemic accord. And so we're really grateful for this panel, grateful for having the opportunity to contribute to this extremely relevant discussion with, and that's our role as IGBA, to be part of it and basically to raise our voice and to contribute to this discussions as well. I'm not sure if you have if anybody else wants to have some concluding remarks based on what we have discussed.
Maybe, Jose Luis, I'd just like to bring one remark maybe to this. I think, one of the major events during COVID was in 2020, there was a shortage of PPE and face masks and this kind of thing. And this set off a real panic around the world, I would say. And one of the kind of lessons from that was that most governments believed that they needed a stockpile of PPE permanently, just in case something like this would happen again, so they wouldn't be caught off guard. I think that thinking has been applied in the similar way to medicines and vaccines now, where that is actually more problematic, because most of the medicines you need in a crisis actually have a short shelf life. So you can't store these for very long. But also from the industry's perspective, and David's views would be good on this as well. In a crisis, what you want to do, what you're looking at from the industry perspective is speed. How fast can I produce? How quickly can I allocate and distribute the medicines to where the patients are? So you're I remember this in 2020. We were always looking at speed. How can we make it faster? How can we go faster? Our production lines, our packaging lines, our movement across closed European borders, getting it over to the US, getting it to India or from India, et cetera, et cetera. This is what we were talking about. But you talk to governments and they just say, we want a fixed stockpile sitting here because that makes me feel comfortable. You know, I think we may, when it comes to medicines, be creating a problem as a result of this, because no one's going to want to leave that comfortable blanket of the stockpile in the event of a crisis. So we're going to have a bunch of stocks sitting around. Maybe there'll be no crisis in Europe and we should send it to the US or India or some African countries or something like that. But I'm sure we will be very uncomfortable doing that. Maybe the stockpile will be sitting in the US. You see, so I think this conversation needs to come out in the pandemic treaty as well. How do we manage that kind of scenario? And I think that's really essentially important. I don't know, David, if you see it the same way I do.
Yes, absolutely. I think that's I think my fear is basically we build up a stockpile and in 5 years we ask ourselves, why do we have a stockpile? Because that's happening in all crises. So basically, we do something, after a while, everybody's asking, okay, this is a lot of money we put in the stockpile, and why do we do? So I think that's always the challenge. So there's unfortunately no real glory in prevention. We have to really acknowledge this and make sure that we still stick to those procedures. What can be done in order to have a more effective system? Certainly to acknowledge there are different measures we can take. We can talk about capacity, we can talk about capabilities, we can talk about inventories. And I would never put all eggs in one basket. So we need a certain mix of measures. That's one important thing. The other thing is, of course, if we can share the cost and also share the benefits, there is a higher chance of getting this implemented. So I would fully agree to this one, that a stockpile should not only sit in one country, but should be used flexibly depending on the potential crisis. Yeah.
If there's no further comments or concluding remarks from other panelists, no? So in that case, I would like to thank you again for being, being part of this very relevant discussion. Globally speaking, I think there has been a very vivid dialogue between the different, panelists, and I think that's a big contribution toward having a more robust pandemic accord. And as IDBA, we are very supportive of contributing in this regard, and being a valuable stakeholder that should also provide insights, especially coming obviously from our experience, that should help to craft a final version that should help the healthcare systems, globally speaking, and at the end of the day, patients, which is the final goal, how we get there, and how we make access to medicines a real thing, and how we can impact in a positive way our societies. So thank you again for your time, and wish you a very nice end of the day. Thank you very much again.